Hey everyone, and welcome back to What After Dentistry. Today's video is one of a kind that we haven't done before, but looking at the response that we received from you guys as on one of our videos, Dentistry in Australia, many of you reached out and asked about ADC Aspirants and Dr. HENNA in terms of how do they provide coaching for Australian dental exams, how is their service, etc. So we thought, why not to have an exclusive discussion about ADC Aspirants as a coaching institute with Dr. HENNA for the application and preparation process for Australian dental exams. In the video, we have discussed completely about their services and the methodology adopted. We also did our homework for you guys so that you all get a fair idea about their service, about the coaching. So we have testimonies from two of our students, which I will be embedding towards the end of the video so that you all understand their experience of enrolling with ADC aspirants. So without further ado, let's get right into the conversation. Hi, Dr. Hina. Welcome you once again on our channel, What After Dentistry, to talk about your initiative of ADC aspirants. There are very less trusted institutions in India which provide dental education, especially for candidates who are trying to prepare for examinations outside India. And with your initiative, we've already got such a good response on our previous video, and I think it's high time that we talk about your institution, and it's really amazing that the work that you're doing. So welcome you once again.
Thank you so much, Dr. Shireen. And let me tell you, it's my pleasure, absolute pleasure to be back here. After our previous session, like you mentioned, I've been getting so many inquiries, and people are saying that, we saw the video and things got so much clear. We would go through the ADC website, but still, things were not clear. But after going through the video, so I must thank you for doing all this, and not just for ADC, but for a lot of other topics as well. So yeah, thank you for having me back. I'm so glad.
Yeah, so thank you so much for the appreciation. And before we get into the formal questions of understanding how your institution works and how, what are the methodologies that you implement to provide coaching, we would like to understand, like, what made you, start with this decision of having this initiative, ADC Aspirants, way back in 2011, where people were not very much keen to practice dentistry outside India. Like the trend right now, it's like trending thing in dentistry, but way back in
Yes.
2011 it was not that.
I completely agree with you. Yes, Dr. Shireen, it was way back in 2011. There were when I was preparing for the exam. I would like to talk about it again. I have spoken about it in your previous video as well. That I gave the part one in 2011, and I literally followed the usual Indian books that I had with me for the postgraduate examinations. I had very less clue. I just knew that I have to have the concepts right and I can answer everything. But then it took a lot of time. So it made me wonder, if I am at this situation, then I'm sure there are a lot of other people out there who must be sailing in the same boat. So why not, utilize this knowledge and put it out there for them to make the, preparation easier and convenient. And that's how it all began. I began with only two candidates. I still remember, and I was giving out notes as much as I could. And today, after 10 years, more than 10 years rather, we are really going very well with it, and we have candidates across the globe who really like the method that we carry out our teachings with. So yeah, it was a brave, bold decision back then, but then it really worked. Yeah, the only intent was that I have to help out those candidates who don't have the time to juggle between their work and their studies.
I think that was really amazing and a very great step that you have taken. So, we would like to understand in terms of if you could share your institute's profile in terms of how do you instruct the coaching? What are the methodologies that you implement? And do you also provide coaching for both part one and part two?
All right. So basically, we at ADC Aspirants, that's what the name of my coaching is. We are, an online-based coaching, And when I say online, I don't mean that we have everyday classes online. No, we have the method of our teaching is purely based on ebooks and articles and journals, which are, which one can just read online. And there's one thing that I would like to tell the candidates who are preparing for the ADC exams, that as try to read as much as possible from your laptops and from your systems, because this is a computer based exam. So what we do is we give out notes and the required syllabus, course guidelines to our candidates, and we have sessions for that as well, which we take up every now and then on a regular basis with our candidates. And talking about the coaching for part 1 and part 2, we are purely into part 1 theory coaching right now, but soon into the future we are planning to venture into part 2 as well.
Okay, okay. I think that's good. And when you mentioned about the sessions, are these sessions like you do it every weekends or how do you do them? Or is it as per
All
the
right.
requirement?
Well, Dr. Shireen, before I talk about, the sessions, I would like to tell the candidates who are watching this video about, brief up about the ADC exam pattern so that they can understand what the sessions also are all about. So basically, we have, these clinical subjects that we need to study. The entire blueprint is given on the ADC website of the subjects. So what we do is we provide, an elaborate schedule. So when I say schedule, I mean you need to study prosthodontics for these many days, endodontics for these many days, and so on and so forth. And then we start solving scenario-based questions, which are the mainstay of the ADC exams. So these sessions are usually taken time to time. By sessions, I mean Zoom sessions, because my candidates are like literally in various parts of the world. So I cannot have definitive time periods, but I do discuss it with them over WhatsApp as to what time suits everybody on a, in general. And then we conduct Zoom sessions based on various topics. And then before the exams, we have doubt clarifications and everything going on.
Okay, okay. I think that's fair enough. So it's like you take one batch and you have candidates in that. Looks like that.
Yes,
Okay.
yes, exactly. We have usually this exam actually is held twice every year. So it's in the month of March and in the month of September. So what we do is, we have around various like 50, 60 candidates in every batch, and I follow up with them. I monitor their progress. So yeah, everything is happens basically online through WhatsApp and Zoom. Yeah.
Okay. And when does the batch starts? Like when do you take the batch enrollments?
Okay, so I'd like to tell you here that our coaching is extremely flexible in terms of joining, enrolling, because I see many candidates asking me as well, when can we join the next batch? But I would like to tell them all that we have no definitive dates, because we understand and we respect every clinician out there who doesn't have the time to start off things on a particular date.
Okay.
I have candidates who have just recently finished or are doing internship or house jobs, varying to candidates who have been in practice, who are extremely busy with their clinics from 9 to 9. So give them the flexibility. You can enroll anytime, but give yourselves at least 6 to 8 months on an average to understand and to prepare yourselves better for the exams.
Okay, okay. I think that's fair enough. And do you also
Yeah.
provide study material along with the classes? And if yes, then what does the study material contain so that it can help the candidate prepare better?
Sure, Dr. Shireen. I'm glad that you asked me this, because during the orientation consultation session, usually when candidates call me on an everyday basis, this is what I explain to them, and I hope through this video things become much more clear for them as well. So what we do is, let's say somebody enrolls with us today. Within 24 hours of the formalities, we start sharing material through mails. All right, and we request everybody to create OneDrive or some Drive ID so that they can start downloading the material that we keep sharing. So we have schedules wherein we have allotted days to finish all the subjects mentioned in the ADC website for the blueprint of the subjects. Like endodontics needs to take around 10 to 14 days, and then so and so forth. But at the same time, we just don't leave the candidates then and there. We monitor with them. One thing that sets us apart from the, I don't know about other institutions, but what I really follow is I am in touch with them through WhatsApp regularly. 24/7, I ask my candidates to ask me doubts at any time.
Mhm.
I understand not everybody is in one part of the globe, so
Mhm.
they have the convenience of reaching out to me whenever they can, and I get back to them as soon as possible, maybe not at exactly at that point of time. Then we have mock tests for every subject. Let's say you finish a subject, you give a mock test for that. Apart from that, once you're done with the entire course once, which spans a period of like 3 to 4 months, we start with scenario based questions. And scenario based questions are not subject wise. I would like to explain this to the candidates who are watching this, because people think that day one of the exam is all about endodontics and dental materials, so on. No. Scenario based questions are literally like a patient walks into your clinic and wants your help about some situation or the other. And it can be an amalgamation of all the subjects out there. So that's how we prepare our candidates from day one.
Correct. I think it's just like virtually preparing the, candidate for providing treatments to a patient. It just sounds like that.
Yes, absolutely. You have literally, nailed it out there. It's, I tell this exact thing to the candidates who are appearing for the exam. I tell them when you read the scenarios, it literally feels as if you are with that Mr. ABC who has come to you for help, and you are going to. And ADC exams are not tough. I would definitely want to tell all those people who come up to me with this question, ma'am, are these questions tough? And it's an overseas exam. How will we be able to tackle it? No, ADC wants general dentists who are able to plan, diagnose, take proper histories, and treat their patients. And if the need arises, even refer. They don't want you to have specialists' knowledge, but they want you to have a complete, thorough, general dental knowledge.
Correct. I think that's good to know. So all you audience, make sure that you have these pointers written down somewhere, because I'm sure this is definitely going to help you prepare for ADC examinations. So moving forward, Dr. Hina, we would like to know what is the average success rate of your coaching so far?
Sure. So, Dr. Shireen, basically, I really, be very honest and upfront about these things. I don't boast of 100% success rate. I don't think anyone can guarantee that. But on an average, if I see the success rate, it's been almost 70 to 75%. But at the same time, I always tell those candidates who are not able to make it in the first time, never lose hope, because in my experience, I've seen the top notched and those extremely skilled dentists who are extremely intelligent also taking multiple attempts, sorry. So it doesn't matter, like, don't doubt yourself if you've not been able to make it the first time. A lot depends upon your luck, on how your day is going as well. So yeah, but to answer your question fairly, I would say 70 to 75% on an average.
I think that's fair enough. And that's a good success rate. Yeah. So, how can one enroll in your coaching institutions, or how can I enroll in the course that you provide?
Okay, so basically we have our WhatsApp numbers which are given on our Instagram handles and Facebook social media page as well. So one can simply WhatsApp us, and our team gets back to them. We provide them an introductory email which talks about whatever we are also speaking about, and also a lot of other things like what subjects and what books and what material will be provided. And just in case, I would like to tell the candidates here as well, all those who are listening to us, we provide study notes wherein I have personally curated notes from various articles and journals and textbooks. Because honestly, Dr. Shireen, I understand that these days, this is not a dental school exam. This is not a university exam where you're just sitting in your room and studying and going to give the exam. This is an exam where I've seen people struggling with language, with children, with their work. They are giving this exam at every age of their life, which is so inspiring, believe me. You have 40 to 45-year-olds giving the exam, you have 30, you have 20s. So, it doesn't, age doesn't matter. But what matters is how conveniently we can provide you the entire course material so you have everything under one roof.
Correct.
So, yeah, that's pretty much how we work.
And is there any exam also, or any kind of interview questions that you ask for from the candidate before they enroll?
Not really, because I believe that when we talk to them for consultations, I believe most of the candidates, at least 80 to 90% of them, have already made up their minds that they have to appear for the ADC exams. So all we do is just encourage them. We always believe in clarifying their doubts about any genuine questions, like how are the examinations, what kind of questions are asked, and how do we help them. But apart from that, I think it's pretty we don't have to literally filter anyone when it comes to enrolling them for our course. uh, Everybody is most welcome to join in.
Okay, I think that's good to know. And do you also provide any after service support to the candidates?
Absolutely. I believe it's not just the coaching that matters, it's also timely intervention in terms of encouragement, in terms of motivation, and not just during the coaching. A lot of our candidates say that, okay, part one can be managed, like we can study for the theory, but what about practicals? Because we have no knowledge. It's an overseas exam, it might be so different from our system in every country. And I tell them that I have a thorough knowledge about that as well. And I give them, orientation sessions even after the part one coaching is over, which is absolutely free. And I tell them about the entire part two system, how to go about it, how to get home setups, and various other things which are required, which are a part and parcel of the practical examination. So I don't believe that, in leaving them midway. My candidates actually become more like my family because you're in touch with them since such a long time. So yeah.
And I think that's really good. And do you also provide contact details of your previous candidates to someone who would want to, understand like whether your coaching is good or not, or they would want to take a testimony from your previous candidates?
Absolutely, Dr. Shireen. I believe that these days you cannot believe anything and everything which is going on, on social media or online. So, to be honest, I remember speaking to a couple of parents as well, whose daughters or sons maybe who have just graduated, or they're going to graduate very soon, because more than them, it's the parents who are more concerned about what the children are getting into. So, coming back to your question, I do provide, first of all the testimonials and everything are very, very readily available on all my social media pages. In terms of providing contacts, I do, but I just confirm it from the person whose contact I'm providing to the other candidate, because sometimes,
Yeah.
not everybody is comfortable, but if my candidates are comfortable, I do provide. And I also make it a habit that whenever I'm keeping a Zoom session, which is a new one after some examination, I include the feedback, or I ask my previous candidates to come on live and talk about their experiences of the exam, not just the coaching. So it gives everyone a very, very good picture of what to expect from somebody who has recently sat for the exam.
Correct, correct. I think that's good enough. And even we did few research. We looked at the testimonies that you already have on your Instagram page. So for the audience, we have testimonies from I think 2 or 3 candidates who have enrolled in her coaching, and they're really happy with the services. And I will be embedding those testimonies in the video so that you can have a look and understand what are the services and how is the experience of the candidate when they enroll with ADC aspirants.
Thank you so much, Dr. Shireen. That's really sweet of you.
So, how do you ensure that the candidate is fit for writing the ADC exam?
I believe, doctor, that if you have graduated in your country, if you have a permanent degree, you are fit enough to give the dental ADC, Australian Dental Council exams. To talk about the examination pattern, like I said earlier, it's completely scenario-based questions, so we don't have to worry about the non-clinical part, which is your physiology and biochemistry, and all those subjects which a lot of people don't really are well acquainted with after completing dentistry. So the best part about this exam is that if you have a good knowledge about your general dental subjects, like periodontics and pedodontics, trauma guidelines, and all these, a lot of other subjects, I think you're good to go. Even if you don't have the correct knowledge, we are here to guide you by providing you the relevant material. We don't want you to waste your time, your precious time, looking up for anything which is irrelevant. And we will be literally we spoon feed the candidates, because we have in our course material, we have pages which are highlighted, we have chapters which are highlighted, so you just read that part and move on to the next one, because revision during the last 1 or 2 months is what changes the game for this exam. If your revision is strong, you will definitely clear the exam.
I think that's good to know. And I was a little curious to know in terms of, since, I'm sure the pattern would have changed in all these years, like starting from 2011 till date. So do you also keep updating your study material as per the current pattern that is being followed by the examination?
Yes, that's an extremely good question, Doctor. Let me tell you. First of all, when we started off in 2011, it was a written examination in terms of writing short answer questions. There were a couple of MCQs, multiple choice questions, and the rest were where you had to write down elaborate stories about, a patient, how do you plan the treatment, etc. Then they changed it to half was scenario based and half were direct MCQs. I know a lot of candidates may get confused, but let me just tell you what are scenario based questions. They are a set of questions wherein you have one scenario which has five sub questions in it, five MCQs, which are pertaining to only that scenario. Let's say a patient comes who's got a pain in his lower molar, and the x-ray is given. So the first set of questions in this scenario based question will be probably on based on the x-ray, what do you see, and there'll be five options. The next question can be, if the patient is on warfarin, what are the precautions or tests to be done. Third question can be something about the other side, where a missing tooth is present. You have to stage and grade the periodontal health. So like this, it's an amalgamation of all the aspects of dentistry in one scenario, including professionalism and dental ethics. So when I say that, you have to study in terms of as a whole, you've got to read all the subjects, and this is what scenario based questions basically is all about.
Yeah,
Yeah.
that's good to know. And there's a very, very important aspect that we have not discussed so far is we have just discussed about the examination part, like preparing the candidate for examination. Do you also help the candidate in the application process?
Yes, absolutely. I because I've seen a couple of candidates, not a couple of actually, most of the candidates struggle with the initial assessment. So initial assessment is the first process, step of the process for applying, and now ADC has made it very, very, very convenient, because now all you need to do is just upload your documents on their website. But the catch is that they want a certain format. For
Mm.
example, even if it's the transcripts that you're uploading, there's a certain format to be followed, which we provide them with. We help them out by providing them samples of the documents which are approved by ADC. So it's easier for candidates to obtain it from their councils and universities. So we help them out with that. In fact, as soon as a candidate enrolls with us, the very next day we have an orientation session, which is a one-on-one video session with the candidate, wherein we explain about the initial assessment if the candidate has not completed that part, and we also talk about how to begin your preparation. So everything is very, very, unfiltered and easy.
Okay. And what about the visa process? Like, do you also explain them, what kind of visa they have to apply if they have to sit for the examination?
Yeah, I'm afraid we don't have, much. We have information, but we don't want to give out the wrong information, because we are not the correct authorities for that. So
Yeah.
whatever we have in our knowledge, we do share it with the candidates. But at the end of the day, I really advise all the candidates to approach some authorities like visa agencies, etc., who have the correct amount of information for this.
Okay, I think that's fair enough. And I think part one examination, they can appear from here itself, right? Or they have to visit.
Yes.
Yeah, it
No,
can.
no, no. Part one can be given from their native countries. In fact, in India has a lot of centers, and a lot of countries, otherwise also. And ADC on their website, some people haven't even gone through the website. So I would like to tell you, if you just type www.adc.org.au, you can go through the entire website, the fee schedule, and what kind of sample papers there are, etc. So they have a list of all the venues as well on their page, so one can go through that.
Yeah, I think that's fair enough. And apart from the ADC examination, do you also help candidates for preparation of, say, dental hygienist or dental assistant in Australia?
All right. So basically, dental assistants, they usually don't need an exam, doctor. So they can just, apply and get the job. But yes, dental hygiene and oral therapy, these are two branches or streams for which the candidates used, they have to give exams. And we do provide the coaching for that as well. We have candidates in our current batch also. And yes, we do help out with that.
Yes, that's good enough. We can have one of your candidate on our channel to talk about this
Why
dental
not?
in Australia in future. Yeah, I think that would.
Yes, absolutely. That would be wonderful.
Yes. So moving on to the almost the last part of our conversation today, and I'm sure it's a very common question that you might have encountered from your candidates is about the fee structure. So do you have any kind of a subscription model, or some packages, like somebody who's joining say 6 months prior, the fee structure would be different. Somebody who's joining say 2 weeks prior, the fee structure would be different. Do you have anything of that sort?
Yes, doctor. Actually, we have a very convenient and flexible kind of a fee structure. Of course, for our regular candidates, what I mean by regular candidates are people or candidates who join any time before their preparation, like 6 months to 1 year. First of all, our fees remains the same for everybody. Whether you join one year prior to the exam or 2 years prior to the exam, it doesn't matter to us. We don't charge, you know, uh, every 6 months or something like that. And let's say that some candidates who are unable to clear the exam in the first attempt, of course, we always try very hard along with the candidates to help them out, but there are chances or days when you're not able to make it. So we readily help them out with their next attempts also without charging anything extra. So we are there with them either till they clear the part 1 exam or they give up. So that is one thing. But for candidates who join, like, who want crash courses or basically who want just the material, or sometimes people want just the past papers because they are extremely important for everybody to clear, we have various other subscription models and we tell them, about these models in detail to people who approach us. So, yeah, but there are various such models for them.
That's fair enough, and I think it's good also because we also get, I'm sure we will be getting the inquiries in the same format. Like, I just want the study material. What about that? I don't want the live session. So yeah, I think that's good.
Yes, absolutely. And we completely respect their decisions because some people literally don't have the time to attend sessions. They just want to go through the, past papers, and which is fair enough. I mean, why not?
Correct, correct. So last question: what is your mantra to success, and how do you motivate your candidates throughout your, while they enroll with you?
Well, I believe, Dr. Shireen, it's very important for the candidates to keep themselves encouraged and motivated at all times. But there are times when people lose hope. They feel that we've gotten into something and now we have to achieve it, and there's a lot of mental pressure along with it. So I ask everybody, all those people who are preparing for the exams, who are studying, who are going to give exams soon, don't let these exams affect your mental health, because these days that is what matters the most. If you're in a very good headspace, everything is going to fall into place, and you have opened a door for yourself. Leave the rest to your hard work and destiny. This knowledge that you're gaining right now, that's not going to go into waste anyway. ADC actually makes you a better practitioner, and I can vouch for that because the kind of books we read, the kind of discussions we have, people have seen this difference in their personal private practices as well. So yeah, just I just tell everybody that just keep yourself motivated and never give up on your dreams, otherwise you'll just regret maybe 10 or 20 years down the line. I wish I had made that decision back then.
Correct. I think that's a very good take home message that one can, imbibe for from our conversation today. So thank you very much, Dr. Hina, for once again coming on our channel and talking about your institution and how do you provide coaching, because I think it's very important. We have also been getting queries from a lot of candidates in terms of we want to contact Dr. Hina. How do we do that? And how what is the coaching that she provides and all of those things. So I thought, why not get you once again and talk about exclusively only about your institution. So thank you
I
very
think it's wonderful. Thank you so much, Dr. Shireen, for having me here today. It's because I literally talk about all these things that I have spoken about today on an everyday basis. Our team is there on our phone, whenever we get inquiries. But then I think YouTube and all these platforms these days are like one-stop destinations for candidates who are looking for information online, and you are doing an incredible job. So hats off to you.
Thank you. Thank you so much. So, all you audience, I hope you understood the kind of coaching that she's providing. And believe me, we have done our research. We never promote anyone very exclusively. We have not done that so far, but we always do a good amount of research before promoting any kind of institution. So, we've done our research. We have got the testimonies from some of our candidates, which I will be embedding in the video towards the end so that you guys can have a look and understand what is the experience that they gained from her institution. So thank you everyone for patiently listening. And I hope this video was helpful. You can always contact Dr. Henna. I will always link down the all her contact details, her Instagram page, her Facebook page in the video description. So do check out the video description. And that's it. And before I sign off, as I always say, please subscribe. It's absolutely free. Like and share this video because this might help out somebody who's trying to prepare for ADC. So thank you very much. I will see you in the next video. Until then, bye and good luck.
Hello. I would like to thank Dr. Henna for her immense support for the past few months while I was preparing for ADC level 1. It was just purely because of her support I was able to clear ADC level 1 in my first attempt. Though I started late and I was really skeptical whether I'll be able to do it or not, but her never say never attitude and every time she was like, no, you can do it, you can do it. So her this attitude helped me a lot during my journey of ADC level 1. The past papers and carefully crafted study material she made according to my need was of great help. So I would really like to thank her for all the support and help she provided, and I would say she is a really thorough professional in this. So whosoever is preparing for ADC level 1, I would highly recommend her course to them. Please reach out to her. She'll be always there to clear out your doubts. She is just a phone call or a message away. She is very prompt in her replies. So once again, thanks Dr. Henna. Thanks a lot. Bye-bye.
Hi, I'm just here. I'm Felipe. I'm just here to thank you, Dr. Henna and Dr. Vishal, for your help. From the written test, I done the coach with you as well. I passed in my first attempt. And now I just finished my practical one. And the coach was good. I had all of the scenarios done. You were really prestative and make your time for me. A lot of coach for the technical day, for the OSCEs day, and I think we cover everything. I could handle good all the situations. Let's see my results, but I think I did really well. Okay, thank you.
Hi, I'm Dr. Serish, and I've been preparing for my ADC practical exam with ADC Aspirants with Dr. HENNA and Dr. Vishal. I prepared for my part 1 with them as well, and I was really happy with that, so I decided to do my part 2 OSCE preparation with them. And both of them have been really helpful, and any doubts that I had any time of the day, they're always available. We had continuous one-on-one sessions just to keep me on the loop of presenting cases, which was, in my opinion, really helpful. Even when I did go to give my exam, I realized that everything that everything was there that was there in the exam had already been discussed. All the questions, all the possible all the scenarios and all the possible questions that they could ask had been discussed already. So I would really like to thank Dr. Vishal and Dr. HENNA for helping me out so much, and thank you so much. I would really recommend ADC Aspirants for anyone who's preparing for part 1 or part 2. Thank you.